Welcome back, everyone. So, our second speaker is Dr. Jean Williams-Woodward. So, Dr. Jean William Woodward is an extension plant pathologist at University of Georgia in Athens. She has been with UGA for 25 years. She provides statewide plant disease diagnosis and management recommendations and extension programming for ornamental plants in commercial greenhouses, nurseries, and landscapes, as well as urban and commercial forestry, Christmas trees, alfalfa, and hemp. She also coordinates the multidisciplinary Master of Plant Protection and Plant Pest Management graduate program and teaches undergrad and grad courses on diagnosis of plant diseases, clinical plant pathology, and ornamental pest management. Hey, Jean, the floor is yours.
Okay. I just want to make sure you are seeing just the title slide, right?
Yeah.
Yeah. Okay. I am going to talk about ornamental disease management. And I enjoyed Dr. Shu's her talk because now I know about flamethrower redbud and as well as also the crepe myrtle bark scale, the website that I have to check out because obviously I got my answer wrong. So I need to pay attention more. But I'm going to talk about some various different diseases, but primarily about disease management, plus also tell you some new things that are coming out. There are a couple of things I want you to remember, though, is that disease management does rely on multiple approaches. You can't just rely on reacting to disease symptoms. And that's what too often people do. I get calls all the time that say, I sprayed, but I still see disease. I sprayed and plants seem to be getting worse. And I just sit there on the other end and go, yes, that's what happens. Because the time from infection where a pathogen may get into that plant to the time the symptoms, that visible evidence like a leaf spot is going to be seen, it could be days to months. Often, when we react to a problem, you see the spots, you apply a fungicide thinking you're going to cure this plant of this problem. What happens is the leaves that are already infected or the plant that's already wilted and showing symptoms of disease, it's not going to get better. The pathogen's already in there. So the plant's not going to look better. The only time the plant is going to look better is if it develops new leaves and you're protecting those new leaves with the fungicide. But if a leaf spot's already present, no matter how many fungicides you put onto it, that leaf spot is going to stay there because the leaf spot is a dead necrotic area. And what's dead doesn't come back to life again. So remember that you really can't cure a plant of a plant disease. So our disease management practices have to be on that preventing the disease from actually getting there. So if we are using any kind of chemicals to control the plant diseases, the best you're gonna hope for is that you're suppressing the plant pathogen and that you're protecting the new growth or uninfected plants. Okay? So I mentioned about the plants seeming to get worse. You have to remember that if the pathogen's already there and you apply a fungicide, it's not going to have much effect on that pathogen that's already there. And so you may not be seeing those symptoms until several days later when the population inside the plant gets actually bigger and the fungus keeps growing or the bacterial cells multiply. And then you start seeing the symptoms. It's very common to see the problem actually get worse. The other thing is like picture I've got here is this is spotty anthracnose. I got my cursor on the wrong monitor. There's spotty anthracnose on dogwood. And so you can see these reddish, round, circular, reddish spots that are on the bracts of the dogwood. Those fungus actually infects at bud break. And so if you're already seeing the spots developing, they're already there on the bracts, no matter how many fungicides you apply on that plant, you're not going to see an improvement. The damage is already done. The other thing is that particular pathogen actually infects pretty much at one time, early in the spring. So in the summer, you may see leaf spots that actually are spotty anthracnose because this pathogen will infect bracts as well as the leaves. But the damage happened in the spring. And so you're seeing the spots and the pathogen is really inactive. So even if you apply a fungicide, it's not going to reduce that or control that disease. You would have to apply it preventatively um, at bud break in the following spring. Okay. So just realize that some of these diseases only may occur one time of the year or have one infection period. And so we see the symptoms of it, but it's really nothing we can do at that time. The other thing is that there are multiple approaches to disease control. There's cultural control, which is things that Dr. Gu was talking about, things like proper irrigation, not too much or not too little, changing irrigation type or timing. And she actually had even mentioned about the angle of the spray for the salt damage. Say I was paying attention. And then as well as like proper fertilization, proper plant installation, as well as care. I see a lot of plants that are being planted too deeply in a landscapes, and that's only going to stress out that plant. And the stressed plant is much more susceptible to disease problems as well as insect problems than a plant that's not stressed. And then the number one thing really for disease management is resistant cultivars. If we can use a resistant cultivar, we're actually ahead of the game. We're reducing the amount of disease that we'll see. So sometimes the list and of what is resistant, sometimes it can be difficult to find. But I know we talked about powdery mildew on crepe myrtles, and powdery mildew resistant crepe myrtles is almost pretty much just about almost every variety that's for sale right now, because a lot of the ones that are very severely infected are usually removed, that people just growers aren't growing. But I do know that we can get you or just because something says that it's resistant doesn't mean that it's immune to the disease. It just means that it's going to get less disease than a very susceptible variety. And then we're talking about powdery mildew is one of the things with powdery mildew is especially on the crepe myrtles is that you can actually get a lot of mildew developing on a resistant variety, especially on the suckers or on the flowers. And so we can get very heavy mildew developing actually on those areas, but the leaves themselves may actually stay pretty green. And so it's just a factor of either the environment, the succulent tissues, that there's factors that actually make those tissues much more susceptible to infection. The other part is mechanical control, and that involves pruning out dead and dying branches, removal of infected leaves, or removing those infected plants. If a plant is a problem plant in the landscape, instead of you keep trying to save that plant, it would be much better if you just removed it and put something else in its place. The other thing with mechanical is sanitation. These pathogens stay around. So leaf spots that I'll talk about, the leaf spot diseases will often cause a lot of leaf drop. Those leaves are going to drop right beneath that plant, and that's where the pathogen survives. So if those leaves remain underneath that plant, every time irrigation water hits it or every time rainwater hits it, it's going to splash those spores back onto the plant again. And so we get this constant infection, leaf drop, reinfection from spores coming off those fallen leaves. And it just ends up depleting or depriving the plant of carbohydrate reserves that ends up killing it. So practicing good sanitation to get rid of the infected plant material actually helps a lot. Then you've got chemicals. I mentioned some of the fungicides and some of the limitations with the fungicides, as well as also bactericides. You have to remember that's all we really have. And majority of our plant pathogen or plant diseases are caused by fungal disease, pathogens. And those fungal pathogens are going to be controlled by fungicides. Fungicides are not going to control viruses, nematodes, and have extremely low activity on bacterial diseases. They also include here biological, and biological is mostly biofungicides. They're products that contain either fungi or bacteria or the byproducts of those organisms. And they can help, but they have to be applied preventatively. They're virtually ineffective when applied after you get disease. Just some limitations for that as well. I want to go into talking about what diseases we actually have concern or right now. And we are going through periods where it's very wet, humid, and warm. And all of those conditions will lead to foliage and crown rot diseases. There are a ton of fungal leaf spot pathogens out there. Pretty much every single plant has a fungus that's going to infect it. And we're seeing a lot of disease and a lot of leaf spot diseases on plants. We've got a lot of root and crown rot diseases, things that are caused by like Pythium and Phytophthora and Rhizoctonia. We've got bacterial leaf spot diseases. They're caused by the Xanthomonas or the Pseudomonas or this Pseudoborax species. We've got Boxwood blight. It is very active, and I'm going to talk a little bit about Boxwood blight. We also have rose rosette virus, which is a beautiful virus if you're a plant pathologist. It's a horrible virus if you actually are a rose enthusiast because it will kill your roses. Powdery mildew, it is extremely active as well. The high humidity, warm days, cool nighttime temperatures really favors it. Powdery mildew disease was actually one of the ones I was taking out of this dog. And so if you have questions about powdery mildew, I know there was a question about preventative control. Probably the best preventative control for powdery mildew is resistant varieties. And that's probably the area the most active plant breeding right now, or breeding for disease resistance, is in powdery mildew disease resistance. So there are powdery mildew crepe myrtles, dogwoods, phlox, pretty much anything that gets powdery mildew a lot, they're trying to breed against it. So that's the number one. The other disease that I've pictured here is called southern blight. It's Sclerotia mossii. Actually changed the genus name to Althea. The picture here is showing the hyphae as well as the brown, tan, kind of mustard seed looking sclerotia. Southern blight is incredibly active right now. It loves the warm, humid conditions that we have. And it's the disease that's going to cause just collapse of the plant. So the plant was perfectly fine this spring. And now all of a sudden the stems are dead and the plants are collapsing. Look around the base of the plant or at the soil line and look for this white hyphae, thread-like material, as well as also these round, tan, mustard seed-like structures. Each one of those structures allows this pathogen to survive in that soil for years. So it's something that if you have a plant that's dying like this, and this was a juga, and it was from a picture that was sent to me by a grower or a landscaper, that if you had this in a landscape bed, then the best thing you can do is actually dig that entire plant plus some of the surrounding soil, dig it out of the ground, put it directly into a bucket so that you're not walking across the soil carrying infested soil, infested plant, and potentially dropping off all of these round sclerotia off that soil. Then take the surrounding soil and just flip it. Dig in at least about 8 inches deep and just turn the soil. So what was on the bottom is now on the top, and what was on the top is buried at least 6 to 8 inches deep. And the pathogen has to survive where it survives right at the soil line. It needs that oxygen. And so if you bury it about 8 inches deep, you actually deprive it of the oxygen and it won't infect the plant. So You can come in and plant something over it or in that area again, as long as you don't dig up the sclerotia again, because it does survive for years. It will start breaking down with other natural organisms, start colonizing the sclerotia and break it down, but it can take years for it to happen. So just showing you that that picture of what that looks like, because that is something we are seeing right now. And then I've just got here everything. There are so many diseases out there that as a biologist, it's awesome because I get to see disease everywhere. But at some point, I'd really love to see a healthy plant. And but not, just because a plant has disease doesn't mean it's going to die. A lot of our diseases will not kill the plants. They just make them look bad. And unfortunately, in our industry, that's a problem because everything needs to look good. There's also some new things I want to talk about today is for Georgia landscapes. One of them is laurel wilt, because that is something that we are seeing and it has been confirmed in actually 3 metro counties. So want to get talking about, not going to talk about all these things. I'm only going to talk about a few of these diseases, but um, one of the big ones to talk about is root disease. The primary pathogen that causes the root disease in landscapes is going to be Phytophthora. Phytophthora literally means plant destroyer. It is a pathogen that infects when soil in saturated soils. Um, it is almost always associated with site conditions. And so if you have compacted soils, poorly draining soils, areas where water is going to pool, areas down downspouts, a lot of things that were talked about in the previous talk, those are conditions that really favor Phytophthora root disease. And so the only way we can correct this problem and try to reduce it is to correct all those poor site conditions. This picture that's here, this is a gardenia, and probably some of you have seen gardenias that look like this. The plant in the background here is actually another gardenia, but it's a slightly uphill from this really yellow, poorly performing gardenia. The plant here is showing a lot of typical symptoms of root disease. So when I get called out, people ask, "What's wrong with my plant?" If I see plants that look yellow, thin foliage, not doing well compared to especially to other plants that are nearby, that's a typical symptom that tells me this is a problem with the roots. And what could be happening is that this plant could be planted too deeply. It is on a slight slope. And so water could be running down and draining into that area. It's up against a concrete wall, and that wall could be actually holding back moisture as well as having water run along that wall. And so this area is staying very wet. The other thing is there's a lot of moss in the front, which also tells me it's very wet. And so the only way that this plant is going to, or you're going to correct this kind of problem in this area is really correct those site conditions. It's improving the soil drainage. It might be installing drainage systems, French drains to try to redirect water. It could be putting on extenders at the base of a downspout so that you're redirecting water away from the plants. It could be reducing soil compaction in that area. And then also making sure the plants are not planted too deeply. This plant will not come back. So even if you want to apply a chemical control like fungicides, applying a fungicide drench, which is where you need to do to get that product into the root system, is really not very effective in this kind of site condition. And the main reason is that the soil types in this area are actually more clay. They're very dense. They're probably also compacted. If you apply a drench on the top of the soil, what happens is the fungicide end just running across the surface, or if it penetrates, it's only penetrating in a very short distance into that soil. So the fungicide isn't reaching the root system. The other thing is the roots are already damaged. And if the roots are already damaged, they're not going to take up that fungicide. So it really is ineffective. You can apply a whole bunch of product and see zero results. And so the best thing you can do in this situation is remove that plant, correct the site conditions, and replant properly, replant with another plant. And then that new plant, you could actually use fungicides on to help and reduce the infection that of those healthy roots from the new plant because you usually are going to be watering it a lot, trying to get it established, especially if you're trying to get it established in the middle of summer. One thing to remember about root disease, you see the symptoms today because it's very hot, humid. Oftentimes we go through periods of lack of water, these mini droughts, but the infection happened in the spring or in the fall or winter for us. So during the cooler times of the year, pretty much fall, winter through spring, that's when infection happened. But now those compromised root systems cannot translocate water enough to support that canopy, and you start seeing the symptoms. So although you think it's happening now, it's really not. It happened way before. It happened months before in the cooler temperatures. Right? These are typical symptoms of some of the root diseases. You're going to see wilting, off colored plants. You're going to see dieback of the interior foliage, or you can see the entire plant that's actually dying. Any of these things, the best thing you can do is get rid of that infected plant because you're not really going to bring them back to life again, or at least never to full health, that they're something that we're never going to have to worry about. One of the other problems we are seeing, especially in some of the flowering annual beds, is also Phytophthora. And it's the Phytophthora aerial blight that we'll see on annual vinca. And so you can see in this picture, this dead stem that's here. It's a tan stem. You get oftentimes wilting plants, leaf rolling, stem death, as well as these brown tan leaves or lesions that develop. The infection is really in the roots or at the crown, as well as spores and like soil particles carrying the spores will get splashed onto the stems of the vinca. And that's where you're seeing some of the stem dieback. This is a problem that's always a factor with water. So if we have a lot of rainfall, or if they're in beds that have a lot of irrigation, especially irrigation that has spray emitters that's actually hitting the foliage, then we see a lot more of this Phytophthora area blight in the annual vinca. The way to reduce it is reduce the amount of water that's there. And it could be especially redirecting water drainage, especially from downspouts. It may be raising the beds and so that you're improving the soil drainage and really note your overhead irrigation should hit those vincos. Or fungicides that can be used, the one plants that are already dead and dying, they need to go. But if you were coming back in and trying to replant to protect those new plants, then you can use some of the fungicides. Or if this is a problem that you've every year when you're planting the vinca, you always have the same problem, then that bed is contaminated with the pathogen. And so, unless you're applying fungicides to protect those new plants, you're always going to see this disease problem. And fungicides that control some Phytophthora are products like the phosphoric acid fungicides, things that are Alliette, Allude, the Vital, the K-Phyte. There's many other generics as well. Their efficacy for particularly this aerial blight can be improved if you were tank mixing it with a mancozeb. That's with 4 or dithane or Protect TL, as well as also many others. The other product that I'd recommend in this situation is Segway, and that's Cyazofamid. That actually does a good job on aerial Phytophthora as well. It also can be used as a drench, but it is, again, drenching a landscape plant is very difficult. There are resistant cultivars. The ones that are in the Cora series tend to get this disease less than other series or other annual vinca types or the cultivar series. So if this is something you've ever had and it's become a problem for you, then trying to get one of the plants that's in the core series may actually help. We talk about fungal problems. Like I said, there are fungal leaf spot diseases. They're everywhere. The warm days, cool nights, high humidity, the prolonged leaf wetness, all of those things contribute to leaf spot diseases. And I'm weird in that I love disease. And I just remember going out last night when I was taking my dogs out. It was so humid last night that it was like you could feel the moisture just on your skin. That's the same thing as on these plants. And so at night, these plants stay wet. And if you happen to irrigate late in the day where you're wetting those plants, then they're going to stay wetter even longer. So trying to for disease management for foliage problems for leaf spot diseases really is about trying to reduce the amount of time that those leaves stay wet. A lot of times our leaf spot diseases are going to peak about this time. That's why I said they're everywhere. They tend to peak in this mid to late summer. It's oftentimes when we're irrigating plants more frequently. We also get these late afternoon thunderstorms that will then wet the foliage late in the day. The only thing you can really do if you do have a lot of leaf spots and you're not willing to accept the plants having leaf spots is apply fungicides, and you're applying them preventatively to protect any new flush of growth from becoming infected. And at this time, we also start seeing flushes of new growth. And that new growth is going to be much more susceptible to disease. It's just young. The waxy cuticles are not really developed. You don't have a lot of your defense mechanisms in those plants or in those tissues. So we tend to get a lot more disease problems. So it's environmental plus also physiological with the plant. These are just example, a couple of diseases. The one that's actually becoming a bigger problem for us is like this Cercospora leaf spot that's on crepe myrtles. There are the varieties or cultivars differ in their susceptibility to this leaf spot, but we still have a lot of our real common crepe myrtle varieties are very susceptible to this leaf spot. And so the leaf spot, and you can see these tan, kind of somewhat angular, irregular shaped lesions that develop on the foliage. The leaves will often turn yellow or orange much more quickly, and then they will drop from the plant. So if you are looking at a crepe myrtle and all of a sudden in another month, it looks like it's bare and doesn't have any leaves on it, you probably had Cercospora leaf spot disease because it will cause a lot of defoliation and premature defoliation. We've also got things like the septoria leaf spot that gets on Rebecca. This disease actually will end up pretty much killing the Rudbeckia. And so if you've had beds where the Rudbeckia is being planted as color in swaths, and all of a sudden you're just seeing a lot of patchiness in those beds where the plants aren't coming back, it probably is you've got the septoria leaf spot disease. And because it will kill plants, will still come back next year, but it's mostly through reseeding or self-seeding of the Rudbeckia in those beds. Uh, got things like the Cercospora leaf spot that's on hydrangea. There's also a Cercospora leaf spot on ligustrum. I've joked before giving talks saying that if you wanted to sound like you knew all scientific names for all the fungi that cause leaf spots, that if somebody gave you a plant that had a leaf spot on it and they said, "What causes it?" You could say Cercospora leaf spot, and you would be right about 90% of the time. So it's just a genus that has a lot of different species in it. They're all very host specific, but it's just a giant genus of for plant pathogens. So we see these leaf spots, like I said, they oftentimes will peak in the spring on the young succulent growth, and then also in this late summer time period. Again, just second flushes, as well as also the environmental conditions. The picture up here in the upper right is the oak leaf blister. It is a fungal leaf spot. disease problem right now. This picture was taken actually in my yard when the foliage, it was taken about a month ago when the leaf spots were still light green and pinkish in color. The leaves actually buckle. The fungus is on the underside of the leaf that causes that. And right now, though, those leaves have dark lesions on them. So those areas that are light in this picture, they actually are tan and grayish color because almost like scabby kind of an appearance to it. The one thing I mentioned about this one is, or the oak leaf blister, is that infection happened in the spring. So although you're seeing leaf spots now on an oak tree, it's too late to do anything with it. The infection happened in the spring, and you would have to apply fungicides at bud break in the spring in order to actually manage this disease. But most of these diseases, these fungal or the diseases caused by fungi causing these leaf spots, they're not going to kill the plant. So I mentioned the septoria, that would, it just robs the plant of carbohydrates, kills all the leaves. So it's not photosynthesizing. So that's an exception, but most of these is not. It will, if you get repeated defoliation over many years, you start seeing a reduction in plant growth, and then eventually you could see plant death. But for the majority of them, they're aesthetic problems. And so if it's in a plant that back of the garden that nobody really sees, I don't care whether it has a leaf spot. But if it is the plant that is right in the center of a bed on the way into the country club, and you have every country club member basically being a plant doctor and telling you about those leaf spots, then the following year, you have to apply fungicides preventatively to stop those leaf spots from ever developing. Once they start, you're not really going to get it under control. I'm always like the bearer of bad news, I feel like. But not all leaf spots are fungal, some are bacterial. The bacterial leaf spots tend, like in this case, these are both oak leaf hydrangeas showing a bacterial leaf spot. These leaf spots oftentimes tend to be more angular in appearance. Sometimes they can have a yellow halo around them. They tend to look water soaked and oily looking. They usually start on the bottom parts of the plant and then move upward in the plant. And that's just from water splashing or water hitting those bottom leaves and then splashing the bacteria upward into the plant. And the same thing happens for fungal pathogens as well. Uh, the one difference about knowing is whether it's a bacterial leaf spot versus a fungal leaf spot is that the fungicides that you would use on a fungal leaf spot disease are not going to work on a bacterial leaf spot. And really, nothing works very good on this bacterial leaf spot on this oak leaf hydrangea. We can use copper products for bacterial diseases, but they're only going to give us about 50% control. They're not going to give us, you know, they're not going to give you more than the so knowing whether it's bacterial or fungal is important to know for the leaf spot or for leaf spot disease management when you're using chemicals. Biggest thing for leaf spot disease management, know your plants, know what diseases they get, keep the foliage as dry as possible. That's increasing air circulation. It might be selectively thinning out branches, not irrigating late in the day. Mentioned also about sanitation, removing those old debris and infected plants, as well as then applying, if you're using fungicides, applying them preventatively to reduce disease development. One of the things, the best things you can do is if you have a disease problem, get it identified what it actually is, then make a note of it in a notebook, on a calendar, or somewhere so that you can go back the next year and look at it and say, what were my disease problems that I have last year? Because you're going to have the same problems again this year, and they're going to happen about the same time. So if you're planning things out, you can almost guess like this problem is going to happen early in the spring at bud break. Make a note on a calendar so you can be prepared for it. So keep those records. There are a couple diseases I want to talk about, particularly ones I'm seeing more of. This is Passiflora needle blight on Leland cypress well as other needled evergreens. This is what it does. And Leland's, we have major problems with Leland cypress. Mostly, many of they're dying. But this is just another disease that actually can kill them in the landscape. And in particular, this picture on the left-hand side, this is a Leland cypress hedge that is a boxed hedge. This is where they are going in and actually shearing the sides and the tops usually, so it makes it more like a box. It's something that's done in places like England. It's I have not seen it done here or not seen it done successfully here in the Southeast. And one of the reasons for that is actually this needle blight disease. And so you can see where in some cases it's almost killed the entire plants. In other ones, it's causing a lot of damage, and those soon will die. Um, and this disease is affects the needles. It will cause a lot of needle drop, and over time, it will just end up killing all the foliage that's there. It's again depriving all carbohydrate reserves, and so plants start dying. Um, in this picture in the center, this is on the Chinese arborvitae, the platycladus. It ended up making this whole group of plants look so bad that they were all removed. And then on the picture on the right-hand side is just showing intermediary or intermediate browning and death from this needle blight. I want to show you what to look for. So when you're looking for needle blight and identifying as is it needle blight, which I used to see in nurseries and Christmas trees, and now I'm seeing it a lot in landscapes. And it's because the pathogen is much more active. We've had a lot warmer winters, a lot wetter winters. The pathogen's not going dormant. So we're seeing a lot of infection that's happening. It used to be in landscapes, it would only infect sort of the interior foliage. And then because we would let a lot of new growth develop on the outside, the pathogen would almost be like buried inside the canopy. And it is a water splash disease. So if water gets to the inside of the tree, it would splash those spores to the new growth and you'd see some disease develop. In the past, we didn't see it develop really within landscapes. You get a flush of new growth, then plants seem to just recover, almost like grow out of any infection. But that's not the case anymore. And it could be a factor of the environment. I mentioned about it being warmer in the wintertime. We're having these moderate, just warm, wet winters. And those winters are actually, the pathogen isn't going dormant. The other thing is we're getting a lot of severe storms that are blowing around the foliage and having a lot of wind driven rain that's splashing those spores out. So we're just seeing it spread. And it's probably an environmental condition for that or environmental reason for that as well. If you're looking at Leland cypress that suspect to have needle blight disease, look for this patchiness. It's almost like a patchwork of tan and gray and yellow and green associated with those needles. And so it's not like the entire shoot and the entire cluster of needles is actually turning brown. It's a very much patchwork like. It's very mottled almost. And you can see it in this picture here in the center, this more sort of up close picture, as well as the picture on the left hand side, where you can see this sort of modeling look to it. So the browning is not the entire branch turning brown, it's patchy look to it. And that's a symptom that I tend to look for when I'm thinking about needle blight disease. Um, it is affecting Leland cypress, a lot of our arborvitaes, as well as Arizona cypress, as well as cedars, junipers. So it's something that we're seeing just a lot more of in the landscape. This does respond to some fungicide treatment. Fungicides containing things like chlorothalonil or the mancozeb, coppers, azoxystrobin, which is the heritage, they can actually reduce disease. But you're applying that to the flushes of new growth to try to protect that new growth from becoming infected. And if you can applying it to plants that already look this bad, like on the left-hand side, it's probably not going to have any effect on this disease, or it's not going to have it's not going to have a satisfactory effect. Yeah, I'm trying to say is that you're trying to protect the new growth from becoming infected. So in the picture that I had previously, I'll just go back to this box hedge that's here. You're not saving that with fungicides. This hedge needs to be removed, or at least up to where the new growth, the plants still look okay. Those plants that still look okay on the very far edge of that picture, those you could apply a fungicide to and probably slow down the disease enough that you'd be able to save that grouping. But the rest of them, you're not bringing them back. And the only thing you can do is get rid of it. And if you get rid of those infected plants, you're reducing the amount of pathogen that's there, the amount of fungus that's there, that you're reducing the amount of spread of that pathogen into that healthier group of plants. So again, it's removal of those infected plants is going to slow down the disease. I also want to mention about laurel wilt, because this is something I'd like for people to be aware of, to even look for. Laurel wilt is something new for us to watch for. This is a map of the current area of laurel wilt that's created by the Georgia Forestry Commission. This is this whole thing is the laurel wilt's not new to Georgia. It was actually first detected in 2005 or 2004, excuse me, and right around the Savannah area. So it's an introduced pathogen. It's an introduced pathogen is because as well as an introduced insect vector. Then from there, it just kept spreading, and it mostly was affecting red bays as well as some sassafras and things along the coast. And then it has continued to spread. What we were finding actually in 2019 and 2020, there was a find in Tennessee, and that's where this cluster is here. If you notice here in Georgia, up here in the metro area, we actually have found it back in 2000, and that is on sassafras. And so it's something, it is spreading. It started out in Cobb County. It then went to Cherokee County earlier this year. And then we just had last week find of it in Fulton County as well. So this is a picture of red bay that's been killed by the disease. Both the insect actually takes the fungus with it. The insect is, I'll show you this in a second, is the red bay ambrosia beetle, the Xyloborus. It infests trees and then introduces the fungus, which is Raphaelia. I had it before and I butchered the name, but it vectors the fungus. It introduces the fungus into the sapwood of the tree, and it clogs up the vascular tissues, and it causes a lot of discoloration on the inside. The insect comes first, the fungus is introduced, the fungus is what ends up killing that tree. Trees will often die within 4 to 12 weeks after a beetle attack. Okay, so it happens fairly quickly. This is something that if all of a sudden you're seeing in those metro county area, those three areas of Cobb, Cherokee, and Fulton, it has been on sassafras. So if you're and these pictures here this is a dead sassafras, and you can see the brown drooping leaves that are on these trees. This was actually found by the Cobb County agent, Hallie Harriman. She found it when she was walking her dog in the park. So this is noticed the trees that were dead and actually investigated it. So if you're seeing some sassafras that start dying very quickly or showing flagging, they might show wilting, yellowing, and then death in a very short period of time. We want to get a sample to know whether, in fact, this is laurel wilt in those areas. What we would do, and the way basically to confirm whether it's laurel wilt, is laurel wilt, the fungus it clogs the vascular tissue and causes discoloration in the sapwood. And so you get these black streaking areas and discoloration in the sapwood behind the bark. And so you can see the streaks here. You can see the discoloration inside this sassafras stem here. What be the first sign to indicate that it could be Laurel wilt is that you would also see some sign that there's beetle activity. So you would see sawdust that might be on the stem, the lower trunk here, as well as also the tubes. This is an ambrosia beetle. We're used to the granulate ambrosia beetle that's been around for years and years. That creates those little sawdust toothpicks on the end. This does the same thing. So we see the toothpicks. That arrow is actually pointing to a toothpick that's coming out of that trunk. We may also just see sawdust around the base of the tree. This is the little insect. It is tiny, so not as big as this picture is showing. It is very small. So you may not see the insect. You'll see the signs of the insect damage or the symptoms of the insect damage, which is that sawdust and the toothpicks. If you take a hatchet and cut into those areas where you may see insect activity, you might see the discoloration on the inside. And so this kind of taking a hatchet to this area and getting this infested or infected and discolored sapwood is what we would need to actually confirm whether this is Laurel wilt or not. We're just trying to map, see how far it's going and where it is going. Diagnosis for Laurel wilt is that if we suspect that there's Laurel wilt, we need a sample of that symptomatic sapwood, the just chips of that sapwood, and we would confirm the presence from that. You can consult with the Georgia Forestry Commission, the foresters in the different counties, or your county, your cooperative extension agents, because we're going to be doing a training with them as well. The one thing to know about Laurel wilt is that there is no control for an infected tree. If a tree is infected, like I said, it's probably going to die within about the only thing you can really do at that point is remove the infected and beetle infested tree. You can burn it and burn the debris on site. The other thing is cut down the tree, grinding the stump to basically soil level, and then chip the wood into about 1-inch square pieces. And then cover that with that wood chip pile with tarp, plastic tarp, and that's to help limit the beetle emergence. Because beetles, even if you cut down the tree, the red bay ambrosia beetle will still emerge from that wood. And those emerging beetles will go off and try to find more trees to infect. So we're trying to limit the spread of these beetles. One of the best ways to try to limit the spread of this type of disease is not to move infested wood off-site, and definitely don't just pile it somewhere where gives those beetles opportunities to actually come out. Where this disease is actually spreading to greater distances, like how it probably got to Tennessee, was probably moved wood. So it was wood that might have been moved either on firewood, and then if the firewood was not burned right away. It's anytime that the infested wood is allowed to sit, then those beetles could actually emerge and they can spread to new areas. So we're trying to limit. There is a product, I mention it here. It's a fungicide. It's the fungicide propiconazole, and it's sold in a product called Alamo that is labeled for use on as a root flare injection. I like the micro injections, and that's what this picture is here on the lower right hand side. It's the canister that you would use. You drill holes, you have the canister in, and then it's basically a pressurized canister. You pop it, and it will inject the fungicide into the plant or into that tree. It is something that controls or slows down the growth of the fungus. It doesn't have any activity on that beetle at all. It is the fungus that does end up killing the tree. And that is why this is actually listed as presented as a potential control for this disease. However, it is not going to go in and cure an already infected tree. So it is something that might be used when you have infected trees, that sassafras trees that are maybe within 100 yards or so, or in the vicinity of a specimen tree that you're trying to protect. So this is not something appropriate to go off into the woods and actually inject every tree. This would be something that you're trying to protect that specimen tree, or there's trees that are in that a yard or area, and you know that this laurel wilt is in surrounding areas. It is not something that can be done just widespread, because you actually have to repeat the application. And the repeating the application, the labeling for this particular product that I have listed here or shown here, is actually, the labeling is that you'd be applying this every 3 to 12 months, depending upon disease pressure, depending upon size of the tree. So at the bare minimum, you'd be repeating this application every year. And so it is not something that is it's not something I'm gonna be recommending as saying, "Yeah, you're gonna do this every time on every sassafras that's in a landscape or park or property that you might be managing." It would be a special case situation that this product might be used in. And I know it's late, and so I wanted to just, last thing is mention is Boxwood Blight. I've talked about it in a lot of different other talks. It is still present. I am getting lots of people calling me saying, "Hey, I had Boxwood Blight, but I've been applying fungicides every month or every 3 months or whatever interval you're applying them," and saying, "I've cured the plants." You haven't cured the plants. The plants actually will, especially in summertime. So at this time of the year, the fungus actually prefers and is most active in cool to moderate temperatures. It is active for us basically from August and September, all the way through the winter time into the spring. And about July, it seems to just be a little more dormant. Oftentimes, we get flushes of new growth. That new growth doesn't show the symptoms, so it looks like the plant's recovered. But that pathogen is still present in all the fallen leaf litter that's inside that canopy, or especially the leaf litter that's fallen off the plants. So boxer blight will cause a lot of leaf drop. Um, Even on this patio here, you can see the little leaves that are underneath this plant. In my studies, I have a field site that I'm infected with boxwood blight, and I have gone out and collected leaves from underneath the plant just last week, and 70% of those leaves have spores. Active spore pathogen is actively sporulating on that tissue. And so as soon as there's that water hits those leaves, it's going to pop those spores or splash those spores up back onto those plants again. Main thing is, I don't want you to get a false sense of security or thinking that all the plants are recovering because they look good. The plant still could be infected, or it is infected. You're just not seeing the symptoms showing up on that new growth. And so the fungicides, there's a lot out there about boxwood blight, about using fungicides, and that they're very effective in reducing disease. And they are effective in reducing disease on very minimally infected plants. The other thing is, they're applied in all the research studies, they're applied on 7 to 14 day intervals. So unless you were applying fungicides every 7 to 14 days, 7 days if it's very wet, it's 14 days if it's a little bit drier, then applying fungicides once a month is not enough to actually slow this disease. Like I said, I always feel like I'm the bearer of bad news, but we'll be talking about boxwood blight probably for years to come here in Georgia. And I'm going to stop there because I know it's 5, and try to take any kind of questions that anybody may have.
Hey, Jean, thank you so much. This is an excellent presentation, I would say. I think so. We are running out of time, basically. So I will just say, if you can quickly respond to one question that's popped up. So the question is regarding Laurel wilt. I think would this attack Morris nobilis?
Yes,
Mm.
actually, the Laurel wilt, it does infect the Laurel nobilis. It does get into that. I didn't actually include that in my list. I had one slide and I forgot to mention some of the um, hosts for Laurel wilt, but Laurel nobilis is one of the hosts for it. So yes, it will get into that.
Thank you so much, Jean. I think I have to conclude here for the
Okay.
sake of time. And I really appreciate Dr. Gu and your talk. It was very informative, and I'm pretty sure the audience appreciate that. Thank you. Okay.